session of the workshop series, The Power of Pause, Understanding and Thriving Through Perimenopause and Menopause. My name is Kavya Tyagi, and I'm a part of the public health chapter at Southwest too. I'm coordinating this workshop as a series of my Girl Scout Gold Award. I'd like to introduce my co-host Dia, who is working behind the scenes today.
Hi, everyone. My name is Dia. I'm an intern here at Sahas.
The Power of Pause is a series hosted by Sahas for Cause, a nonprofit organization committed to educating, empowering, and supporting South Asian immigrants as they navigate life in the United States in partnership with Girl Scouts, a youth organization for girls in the US to build courage, confidence, and character. Sahas offers culturally centered programs, wellness support, and resource navigation to help individuals overcome challenges and improve their overall well-being. This series is a part of the Family and Women Wellness Initiative. I urge you to visit sahasforcause.org for more information on our initiatives and programs. Now we'll be announcing our raffle winner from session 4. Please congratulate Urbi Mehta. We will be putting the link to this session's post-test near the end of the hour. Join us in this empowering series to understand your changing body, gain practical tools for everyday well-being, and break the cultural silence around menopause. Just a disclaimer, this menopause workshop is organized and hosted with the aim of providing general education and awareness on menopause and related health topics. The information shared during this workshop, including presentations by guest speakers and physicians, is intended for informational and educational purposes only. The content provided should not be considered medical advice, diagnosis, or treatment. Participants are encouraged to consult their own qualified healthcare providers regarding any medical concerns or decisions related to their individual health. By attending this workshop, participants acknowledge and agree to this disclaimer. We are also recording this workshop. The topic of our session today is on physical health. Please welcome our speaker today, Dr. Vaishali Saste. Dr. Saste is a board-certified medical oncologist practicing at Kaiser Permanente in Riverside County within the Hematology Oncology Department at Moreno Valley Medical Center. Her clinical focus is on sarcoma oncology, where she brings both specialized knowledge and a passion for providing high-quality care to members. Please note that mics should be muted throughout the duration of the webinar. During the last 15 minutes, we will have a Q&A and post-test for participants to share their thoughts. As a reminder, those who complete the post-test will be entered into a raffle to win a $30 gift card. Without further delay, let's welcome Dr. Saste.
Hello, everyone. My name is Vaishali Saste. I am a practicing oncologist in Kaiser Riverside service area. I am not a gynecologist, but menopause actually is a very passionate topic for me, as well as my, friends, and especially when we are all going through the changes in our body and changes in our life. So it has been very passionate topic for me. The other thing is I do treat breast cancer patients, and a lot of them are put on medications that makes them go through menopause or menopausal symptoms, and I hear them every day, and the complaints, not complaints, but the body changes that they go through and the frustrations that they go through. So it's a very passionate topic for me, and that's why I'm being a gynecologist today, which I am not. So let me share my slides with you. Kavya, you might want to tell me, do you guys see my slides? I'm trying to share my screen.
Give me 1 second while I make you a co-host. You can do that.
Okay.
Now you should be able to.
Me. Do you see my slides? Do you see it now?
Not yet.
Not yet.
Okay, now?
It's loading.
Yeah, we can see your slides now.
Okay. I don't know what you see on my end, but there it is. Okay. So first of all, my disclaimers. I did go through one. I'm not a gynecologist, but I do have the ability to do research, which is evidence-based. I'm not getting paid for this presentation. This is purely my community work for Sahas. And thank you, Sahas, for bringing up this important topic. And thank you all the participants for taking your time on a Friday evening to listen to my talk. I am not recommending or endorsing any treatments. I'm not endorsing any medications. And if you need a personal medical advice about your own personal health, I would suggest you talk with your doctor. Going through menopause, menopause is a systemic transition. It's not something that, one organ limited. It's actually multi-organ transition that a woman goes through in her menopausal or perimenopausal age. It affects multiple organs, brain being one of the main ones, metabolic changes in body, cardiovascular or heart-related issues that can happen, musculoskeletal issues, which is related to your muscles and bones. It does affect your sexual health. The other topic that I will be talking about is Women's Health Initiative, which talks about introducing or reintroducing hormone replacement treatment, and what are the directions that we would go in future. Brain is the organ that's where the menopause starts. It is the first organ that registers that a woman's body is going through menopause because estrogen plays a very critical role in glucose metabolism, thermoregulation, as well as sleep. The signaling that goes through brain hormones just goes haywire during menopause, and almost about 70 to 90% of women experience the neurological symptoms, which most of you probably have already experienced it or already experiencing it. Difficulty concentrating, mood swings, mood changes, anxiety, not being able to sleep at night, not finding the right words at the right time, which I go through all the time. So this is where it starts. That's where you start recognizing that something is changing in my body. This is a slide that,
Dr. Saste, 1 minute.
yes.
Would you be able to turn the presentation into presentation mode?
Bottom right.
Yeah, just click this icon at the bottom.
Yes, that one.
Yeah.
There you go.
Awesome,
Okay.
thank you.
So this is the slide that kind of explains us how the hormones go. It's a very simple slide to understand. This is our premenopausal state when our hormones are going in cyclic fashion, and that's when we get menstruation or menstrual cycles. This is all when life is really good. This is where our life goes haywire everywhere. As you can see, the hormones going everywhere. They dance everywhere. Estrogen, progesterone, FSH, LH, they are going everywhere. This is where majority of the changes in our body happen. This is where we kind of notice that there's something that is not right with my body. I never felt this way, but why do I feel this way? And this is our postmenopausal state when the hormones kind of just, slow down. They kind of, level down. Perimenopause can happen at any age, starting age 35. Average age is about 43 years, and it can last for up to 4 years. Some women it lasts for a year, 2 years, but for most it can last up to 4 years. It can begin, as I said, in late 30s and can last from 2 to 10 years. It is a highly individual experience, and I'm saying it in a stressful manner because because what I feel, you're not going to feel, or what you feel, I may not feel. It's very different. It's a very personal experience. What your symptoms are may not be my symptoms. Menopause is defined by absence of period for 12 months. For 12 months together, continuously, if you don't get a period, then that means you're in menopause. This is what I was talking about, with symptoms. What are the symptoms? Everybody feels differently. Some feel that their body is changing, their shape is changing. Why am I gaining weight? Especially in the midsection, in the abdominal area. Why do I feel anxiety all of a sudden? Why do I feel loss of libido? Why do I have hair loss? Why do I have, mood swings? Why does my family say that you're more irritable these days? Why do I feel that my muscles are getting weaker? Why do I feel that I am getting weaker? Why do I feel joint pain? The joint pain could be anywhere, in your hands, in your feet. Like you get up first thing in the morning, you're so stiff, you cannot walk. Why do I feel my eyes are dry? Why do I feel that, I'm getting up in the middle of the night, sweating, my clothes are, soaked, I have to change them. And why do I have that brain fog? Why am I forgetting things? I went to the grocery store to buy 3 things, I came back with 2. Why did I keep the milk in the pantry instead of keeping in the fridge? So this is real. This is a real problem. This is not something that someone is making up. These are real symptoms, and these are all related to menopause or perimenopause. Brain, as I said, is the main, organ that recognizes, is the first organ that recognizes the change. Even before your menstrual cycle changes, you may be getting regular periods, but you may be feeling some of the symptoms like the hot flashes or anxiety or mood swings or the cognitive function changes. And that is because estrogen, our brain needs estrogen to regulate the glucose metabolism. As you know, we need sugar. All the organs in our body need sugar for metabolism, and estrogen is the hormone that regulates the glucose metabolism in the brain. Almost 70% of the women will experience the symptoms that I just talked about, and that decline in the estrogen can cause that energy gap that comes from the glucose metabolism, and that's where you feel those symptoms. The sex hormones, we have 3 sex hormones: estrogen, progesterone, and testosterone. Estrogen helps to regulate and release the metabolism of dopamine, serotonin, all these happy hormones, the endorphins. It makes us happy. It is neuroprotective. It protects our memory, our cognitive functions. It increases the absorption of glucose. The progesterone works in anxiety. It is anti-anxiety. It helps. It has a sedative effect. So, the sleep pattern, it regulates our sleep pattern. It regulates our straight, irritable mood. And it also helps to modulate some signaling, which is involved in memory as well as learning. So that's progesterone. And testosterone is mainly, for your sexual drive, your emotional regulation, as well as for your muscle build or muscle strength. The transition that happens in menopause, this is again what happens when you're going through menopause. It increases the insulin resistance, meaning the glucose metabolism gets affected. You become resistant to insulin. That can lead to diagnosis of diabetes, especially in postmenopausal age, liver disease, which is called fatty liver, fat deposition in the liver, and it increases visceral fat. This is something very important. I'll talk about visceral fat here in a second. I'll go through the next points. It increases or changes your cholesterol levels, and it causes loss of muscle tissue, which causes decrease in energy. Like, okay, I get tired and I don't know why, or I was able to walk 3-4 miles a day. Now I walk 2 or 3 and I get exhausted. I don't know what's happening with me. The visceral fat is very important. So if I'll give you my mom's example. If I look at my mom's picture when she was, in her 40s or 50s, and when I look at her now, she's way thinner now. She's very thin, but she has gained a lot of weight, or not gained, but she has retained a lot of weight around her belly section. She was never diabetic until the age of 60, and now she's a diabetic where she has trouble controlling her sugar. So if you look at her, it's a norm for us, especially in our culture, to say, oh, you've gained weight, oh, you've lost weight. When we see older, as we see our moms or ourselves getting older, we might see that we are actually looking thinner and thinner, but that doesn't mean that's a right kind of weight loss. Yes, that person is losing weight, but the main weight loss is in the bones and in the muscle. And what we are gaining in place of that muscle and the bone is this unnecessary fat, which is visceral fat, which we cannot see from outside, is actually inside our organs. It is wrapping around all our internal organs. And that is the dangerous fat that, we have, because that causes insulin resistance, that causes risk of diabetes and heart diseases. What we see that, with multiple research, research that has gone, what is seen is that, most of us, you probably know what DEXA scan is. DEXA scan is a scan, to make, explain it in a simple way. It's a scan that is done to see how thick or thin your bones are. As we age, our bones get thinner, which is called osteopenia or osteoporosis. The DEXA scans basically show the same thing, that as we get older, there is a lot of bone thinning that happens. The word FMP in this slide means final menstrual period or final menstrual cycle. 2 years before your menstrual cycle, last menstrual cycle, we start gaining fat, and the lean mass, which is the muscle mass, it goes down. We start gaining fat, and that's why our body shape changes. I'll tell you my own experience. I'm 50. Last 2 years, I did notice a sudden change in my body where, okay, what is happening here? Why am I haven't changed my diet, I haven't changed my exercise, but something is going on with me, with my body. And all of a sudden you see that, okay, well, I'm not fitting in my clothes. This is a real phenomenon. This is not something that somebody is making up. And it's not that you're not doing the right things. This is something that is very physiologic that happens to our body. What, again, is the same thing that the slide says is, we gain the abdominal fat, subcutaneous fat, and the adipose tissue or fat tissue around our organs. And that can result into increased cardiovascular or heart disease as well. It's a very scientific slide, but I'll make it easy for you. I don't know. Can you see my arrow?
Yes.
Okay. So I'm going to move my arrow. So this part on the left of this bar is your premenopausal or, premenopausal stage. And the on the right side of the bar is your postmenopausal. Simple thing to explain is that as we get older, this blue line is our lean mass, which is the muscle mass. The muscle mass is going down, and the black part here is the fat mass, which is the fat that we gain. So this is, this slide also explains how body changes. The lean mass is going, the fat mass is going up. You may not necessarily lose weight. Your weight may be the same, but your body composition certainly changes. Menopause definitely increases the risk of heart disease. This slide explains what estrogen does. On the right, do you see my arrow?
Yes.
Yes.
Okay. In the premenopausal female, in premenopausal state, the blood vessels are very easy to dilate. There's a lot of estrogen for that blood vessel to dilate. As we get older, estrogen drops and that blood vessel becomes rigid. It doesn't expand as it needs to. That leads to increased risk of high blood pressure. That leads to increased risk of stroke and even cardiovascular disease, as I mentioned earlier. This is another example. Now, I'm going to talk a little bit about hormone replacement treatment, hormone replacement therapy that is being offered to women these days. I'll come back to it towards the end of the talk also. But this is another slide that explains. So the about in 70s to 80s, it was a very common practice to prescribe hormone treatment to women who are in menopause or going through menopause. It was done in the form of pills, and those women will be on hormone replacement therapy for, let's say, 5 years, 10 years, whatever. But then in 1999, there was a big study that came. That study actually make headlines in the news. I mean, none of the studies make headlines in the news or so, or I cannot say none, but most of them don't make it. But that was a very big headline that basically put a black box warning on the hormone replacement therapy, because what that study showed is that hormone replacement treatment increases the risk of breast cancer, it increases the risk of blood clots, and it increases the risk of strokes. That basically pulled the hormone replacement therapy out of market completely for years and years, until literally about a year or two ago, when they went back, looked at the data, restudied, reevaluated, a lot of dissection was done, and basically found out that the study that was done was not done properly. It was done in older patients who already were at risk of risk of heart disease or blood pressure or stroke, patients who already had increased risk of breast cancer because of age. As we get older, our risk of breast cancer does go up, or any cancer for that matter. So when they refurbished the study, they actually found out that introducing hormone replacement earlier in the premenopausal state, or perimenopausal rather, sorry, has actually shown to be of benefit to certain women. I'm not going to say all, certain, because it's not applicable to everybody. And this is one of the slides that I wanted to bring here. This is how aging, changes the composition of our blood vessels. This yellow part here that you see is fat. We do deposit fat, or what we say, if you read any scans or see, you will see atherosclerotic patches. These are the ones, calcium deposits, fatty streaks. As we get older, they tend to get, higher. Again, I'm not saying that this is going to happen in every woman, but for most part, it does happen. It's a part of aging. If the hormone replacement treatment was introduced early into perimenopausal state, this is what they saw. They saw that the progression of this fatty streak into these women was definitely halted. This is a slide that says that, okay, what if we started at age 60 or 70? Yes, I went through menopause, but I want to try it now to prevent it. But they actually did not see any benefit if it was introduced later in your menopausal state. So that's pretty much what this slide says. Menopause does affect our musculoskeletal health, and this is where actually I was having issue. I actually had really good slides that I put here to kind of show you some cartoons, but I could not upload it for some reason. But during menopause, we lose our bone mass, and it's actually very rapid. It's not something that happens over a period of time. It's actually very rapid. As Southeast Asian women, I believe most of us are here are Southeast Asian. We are more prone to having osteoporosis just by genetics. It is because the cells that destroy bones, they kind of overtake the ones that maintain the bone health. As we get older, we are at risk of osteoporotic risk, fractures. If you talk about, you probably have heard, oh, XYZ fell and she broke her hip, or she broke her wrist, or there was a fracture in her vertebral fracture, which is in the spine, which was very painful, and it took a while, and then now she's so weak. She was very active before, she's not, because these fractures are a majority cause of increased mortality in these women, because one fall, fracture the hip, you lose your muscle, you lose your strength, you lose your independence, you lose your, once you lose that sense of independence, you lose a lot of, mental strength with it. And, that kind of accelerates demise of that person. The lumbar spine and hips are they're the main weight bearer of our body. And those are the bones that get affected with this osteoporosis. That's the scan. The DEXA scan is the one that measures the density in these bones. So make sure that, you get DEXA scans done, especially after menopause, to make sure that your bone density is where it needs to be. This is another slide that kind of tells how it works for men versus women. Unfortunately, I feel that sometimes God was kind of unfair to woman body. The bone loss, as you can see in a woman after 50 to 60, is very rapid. It's a sharp decline in bone health compared to what happens in men. This is another slide that explains, bone loss is very prevalent after menopause. Coming back to the hormone replacement treatment, this is another thing that was seen with hormone replacement. If you start it within 10 years of menopause, 50 to 60s average age, it reduces the risk of vertebral fractures by 34%, and it reduces hip fracture risk by, more than, 27 or, almost 30%. This is, another slide. It's pretty scientific, but, again, on the right side is the protective mechanism from the estrogen. It enhances the bone forming cells in the bone. And on the left, when you don't have estrogen, your bones become basically porous, like spongy, very easy to break, even with minor trauma. Muscle and menopause. Muscle, the skeletal muscles are very dependent on estrogen. The glucose metabolism in muscles is very dependent on the estrogen. The receptors are all over the skeletal muscles. When you're going through menopause, the ability of the muscle to get regenerated or reformed is definitely compromised. We lose a lot of muscle mass, and that causes loss in strength. Decreased estrogen causes decrease in glucose metabolism. It causes, again, fatigue. Exercise recovery is very slow afterwards, and it also causes inflammation because you lose your balance. You get prone to injuries as well, and that's where the fall risk also goes up. So there was one study that I actually saw recently. I could not put it here. Is the size of your butt tells how, this is exactly how the wording was. The size of your butt tells how strong you are, especially after being in menopause. As you see again, in older women, we see that their buttock size actually gets smaller and smaller. It shrinks. Our leg muscles, or those muscles, are the biggest muscle mass of our body. They carry our weight, and during menopause, because of all the changes that happen, we lose that muscle, and that's what we see, that it's shrinking there. And that's where the weakness comes. That's where we hear again, that it's harder for me to climb stairs, and that's when we start looking for elevators than looking for the stairs. So this is real muscle loss. When that happens, when the muscle loss happens, again, we may not see change in weight. So that loss of muscle is replaced by fat. And again, this is the bad fat that we don't want. So it joins, basically it affects joints, bones, muscles, connective tissue. One of the things that is very commonly seen, actually, I've seen it in a lot of my patients, is frozen shoulder. You're doing great. Everything is going fine. One fine day you wake up, you have, you cannot move your shoulder. You didn't pick up anything heavy. You didn't push anything heavy. You just cannot move it. Again, this is a real syndrome that happens perimenopausally that causes, a lot of pain. You have to get physical therapy, maybe even steroid injections to loosen up that shoulder so that you get your ability back. So this is something that is a common phenomenon that happen around perimenopause. So if any one of you is going through this, you probably want to think about that, okay, I'm going through, perimenopausal state. What is it that I need to do for myself so that I, take care of myself down the road? Again, this is something very common in Asian populations. Genitourinary syndromes of menopause. Again, this is a not very openly talked about topic. As we get older, the loss of estrogen causes the vaginal tissue to become very thin, dry, different symptoms, burning, itching, urination problem. You run to the restroom quite often. You feel like you have to go every 2 hours. That is again because the pelvic floor or the muscles that are in the pelvis that support the bladder, they lose their elasticity and bladder literally falls, and you have the sensation that you have to go again and again. Again, there are different treatments that can be done for this. The hormone replacement definitely helps, but if you don't want to go that route, topical treatments definitely help. There's a low estrogen cream that can be used. There are, multiple tablets, rings, or inserts that can be used to, help with the symptoms. The loss of estrogen and the dryness in the vagina also causes sexual dysfunction in a lot of women, and we do recommend that use the lubricants that are over the counter. They do help with preserving sexual health. Coming back to the Women's Health Initiative, this is what I was talking about earlier when there was the black box warning was placed on hormone replacement therapy. It was studied mainly in postmenopausal women, and they already had some pre-existing conditions, and that's why they saw the increased risk of cardiovascular disease or strokes or even breast cancer in these women. And it was reinterpreted recently. The timing was wrong. There was different risk profile that was seen in younger women. The route and formulation did matter. The doses that were given at that time were really high. What is prescribed now is very low dose estrogen. And it did not only relieve the symptoms, VMS here on this slide is vasomotor symptoms, which is hot flashes. I did not only help with that, but it also prevented risk of cardiovascular disease, risk of diabetes, as well as unnecessary weight gain. I had a couple of slides that were put in between because another major part of my talk was about diet and nutrition. What kind of diet, what kind of nutrition and exercises. But I will definitely talk about it just like this. As again, as we get older, our composition is changing, our body is changing. We might be doing one kind of exercise all along, like, okay, I've been walking 4 miles every day, but now I don't seem to lose any weight. That's where the strength training comes in the picture. Exercise with weights, weight bearing exercises like walking, light jogging, balance exercises like yoga, Pilates, Tai Chi. They definitely help build the muscle mass and help with the bone health as well. In terms of nutrition is a vital part of going through menopause. Not every woman is a candidate for hormone replacement therapy, or not everybody would want to take hormone replacement therapy, and that's completely, understandable. So what are the other ways we can prevent some of these symptoms? Diet definitely helps. Diet rich in good fats, avocados or olive oils or avocado oils. Diet rich in those. If you're a vegetarian, of course, eat protein in the form of tofu or edamame. If you're a meat eater, try to choose cleaner meats like white meats like chicken, fish, turkey. Definitely fruits and vegetables or antioxidants definitely play a big role in our nutrition to try to manage some of these symptoms. Hydration is the key. Make sure that your body is very well hydrated. People who have sleeping problems, or who are having sleep irregulations, magnesium definitely helps regularize the sleep pattern. um, Other ways to handle some of these symptoms besides hormone replacement, other pharmacological or medications, there are SSRIs like Paxil. It does help with menopausal symptoms, the hot flashes, the mood swings. There are medications, again, that can be like topical estrogen for vaginal health. That definitely helps. The absorption through the vagina is very, very minimal. So those definitely help with the vaginal health. There are medications like gabapentin that also helps with some of the menopausal symptoms. So in conclusion, it's a transition. It's a multi-system event. We need to understand our bodies. We need to understand what changes are happening. We cannot dismiss ourselves saying, oh, well, this is something that everybody goes through, so I might as well just suck it up. No, this is not something that we need, we should do. We should listen to our body. We should address the symptoms, not being able to sleep at night, having hot flashes, having mood swings. As a family, you can talk also about, in your family, that this is not something that is you're doing intentionally. This is something that you're going through a phase of life. Hormone replacement is not, it can help. It's not a fix all, definitely doesn't help with a lot of symptoms like, it's not magical that you get on hormone replacement and you're losing all your weight. Absolutely not. They may not be safe or appropriate for all the women. So we basically just pick whoever is the right candidate for that. And then just getting into healthy habits, as we talked, the exercising, eating healthy, and socialization definitely helps. We are human. As humans, we are herders. We need to herd. We need to herd together with people alike. We need to mingle with people who have similar thinking. It does help us. It elevates our mood. It does help push us to do things that we never tried before. So that also helps with a lot of the symptoms that we are going through. And medications we talked about. So these last two slides are actually, you can take a picture of these slides. These are some of the references or books that are that talk really good about menopause, menopausal symptoms, and how you navigate through the changes that you're going through your body. This one and the next one is some podcasts or some resources. And that's pretty much it.
Thank you so much, Dr. Saste. This was such an insightful talk. We have some questions that we would like to ask you. The first one is HRT is HRT an option for women following breast cancer history?
Depending on what type of cancer. There are different types of breast cancer. One of the types is estrogen dependent, which basically it means that it thrives off of the estrogen. Those women, we basically do not recommend the hormone replacement treatment. But then there are what we say triple negative breast cancers. Those patients we can consider a hormone replacement.
Okay, thank you. We have one more question. How can you minimize hot flashes, and how can you hydrate, sleep well, and de-stress in the incidence of hot flashes?
Okay. So hot flashes, does it mean by medications or without the medications?
I'm pretty sure without the medications.
Okay, I'll talk both. Medications, definitely. There are medications like the SSRIs like Paxil. It does help with hot flashes. And that's actually one of the medications that I use for my patients who are on estrogen blockers. Exactly opposite of hormone replacement. They're going through these hot flashes and mood swings, and Paxil definitely helps with the symptoms. There are a couple others that also help. Gabapentin is another one that definitely helps. Non-medication treatments would be increase in the phytins, which is like the foods that mimic estrogen, like tofu, soy products, edamame. Those definitely help minimizing some of the symptoms.
Thank you. Just a quick announcement. Please look at the post-test in the chat. Once you fill it out, we will be able to enter you into the post-test for a $30 gift card raffle. We have a couple more questions. How can you control the fatigue and the mood swings in spite of having healthy eating?
That's a very good question. So again, you saw the slides, it's a multi-system phenomenon. It's not just like one fix for any of these symptoms. So meditation, mindfulness, yoga, yes, you're eating fine, you may be eating right, but there may be something physically that you may not be doing right. For an example, if you are somebody who likes to walk or hike, you're only doing hiking, walking. No, it's probably not going to work. You need to change what you're doing. So mindfulness, I'm a big proponent of mindfulness, definitely helps. Meditation, whichever way, you want to name it or brand it, that's fine. Yoga is a very good exercise. You don't have to be all bendy and twisty to do yoga. It could be simple, down dog, or a padmasana or something like that. But even that pose, maintaining that pose for a few minutes in, outside of, your, noisy environment, like maybe in your backyard, or first thing in the morning, listening to the birds. Yes, that will help you. So those are some of the, things that you can do to try to avoid that, those stresses that you have in your day-to-day life.
Thank you, Dr. Saste. We have one more question. Do you need treatment or medication if menopause or perimenopause comes earlier than expected?
Yes, depending on your symptoms. Yeah, if you're very symptomatic, again, if you're going through menopause very early, again, remember the muscle loss, the bone loss is going to happen early and quickly, and that is going to cause more problems. So, yes, absolutely. If you're a right candidate for treatments, you should be. In fact, women who get their ovaries taken out, or they go into menopause, there's actually a phenomenon called, premature ovarian failure. Like a lot of women in their 30s, they go through menopause. No reason why, but they do. Those women do get put on hormone replacement, at least until their menopausal age, to prevent all of these health problems that can happen down the road.
Thank you, Dr. Saste. We do have
You don't have
question.
to say thank you, Dr. Saste, after each answer.
Okay. All the medications that you talked about, are they over the counter, or would you need a prescription from a gynecologist?
No, hormone replacement is a prescription. SSRIs, or the non-hormonal treatments for symptom management are also prescription.
Okay. So I would like to end off with a couple of ending words. So as you know, this is the fifth and final session of the Power of Pause series. So I would like to take a moment to thank the wonderful team that has been behind the scenes to make this possible. This project would not have been possible with the speakers who have dedicated their time to educating the community. I would like to thank Dr. Panda, Ms. Kirai, Ms. Tejal Modi, Dr. Cecilia Margaret, the speakers who are not here with us, and of course, Dr. Saste. Thank you so much. You've just finished an amazing and very thorough presentation. I'd also like to
hope I did my due diligence.
Yes.
Thank you.
Thank you so much. I would also like to thank the Dr. Raji and Chitalanti, who have consistently spearheaded this project and put in the precious time and energy to help and volunteer for the community. I'd also really love to thank our social media team for working on last-minute flyers, posts, and Instagram reels. And of course, I'd like to thank everybody who's been following along for this journey. And I hope that you have learned something along the way. There is a lot of information about menopause out in the world, so we created this series to cater to South Asian women and create a safe space to ask the right questions. So this series is in coordination with the Sati Project at Sahas for Cause, which aims to create a safe haven for women and educate the community on risk and protective factors for domestic violence and teen dating violence. The Sati Project provides leadership positions for girls and women. So if you want to get involved, we will be sharing a QR code right now. I'll just quickly share that with you. So please scan this to join Sahas and engage in any of our new activities and workshops. So I will come back to this a little bit later. I'll reshare my screen. So this workshop is also concluding my Gold Award for Girl Scouts, which is the highest achievement in Girl Scouts, where girls have to individually develop a long-lasting community service project. It's really been an honor to connect with the South Asian community and address this essential part of a woman's life. The Power of Pause series will be continued through other Sahas workshop events and introducing more aspects of menopause. So I'm going to reshare my screen on the QR code, and I'll just leave it up here. So thank you so much all for joining this workshop, and I hope you all have a good night.
Thank you.
Thank you so much, Dr. Saste.
Welcome to the fourth session of our workshop series, The Power of Pause, Understanding and Thriving Through Perimenopause and Menopause. My name is Thea. I am a master's student and I'm part of the Family and Women Wellness initiatives here at Sahas. I would like to introduce my co-host Kavya, who's working behind the scenes today.
Hi, my name is Kavya Tyagi, and I'm a part of the public health chapter of Sahas Youth. I am coordinating the workshop series as a part of my Girl Scout Gold Award.
The Power of Pause is a series hosted by Sahas for Cause, a nonprofit organization committed to educating, empowering, and supporting South Asian immigrants as they navigate life in the United States in partnership with Girl Scouts, a youth organization for girls in the U.S. to build courage, confidence, and character. Sahas offers culturally centered programs, wellness support, and resource navigation to help individuals overcome challenges and improve their overall well-being. The series is part of the Family and Women Wellness Initiative. I urge you to visit sahasforcause.org for more information on our initiatives and programs. Now we will be announcing our raffle winner from session 3. Every session, we will be having a raffle based on completing the post-test form. So please congratulate Sravanti Polesetti. We will be putting the link to this session's post-test near the end of the hour. So join us in the empowering series to understand your changing body, gain practical tools for everyday well-being, and break the cultural silence around menopause. Before we begin, I'll be giving a quick disclaimer that this menopause workshop is organized and hosted with the aim of providing general education and awareness on menopause and related health topics. The information shared during this workshop, including presentations by guest speakers and physicians, is intended for informational and educational purposes only. The content provided should not be considered medical advice, diagnosis, or treatment. Participants are encouraged to consult their own qualified healthcare providers regarding any medical concerns or decisions related to their individual health. By attending this workshop, participants acknowledge and agree to the disclaimer, and also a disclaimer that we are recording this workshop. So the topic of our fourth session today is emotional health. Please welcome our speaker today, Celia Margaret. She's originally from Madras, India, where she completed her medical school, and she moved to the US to pursue developmental neuroscience and advanced psychiatric training. Her primary interests are consultation psychiatry, addressing diversity, prevention and collaborative child and adolescent psychiatry, and global mental health. She serves both children and adults in the states of Washington and California. One last thing. Please note that mics should be muted throughout the duration of the webinar. We will be having a Q&A and a more interactive portion later with Dr. Margaret, and a post-test again will be shared towards the end of the webinar. And again, whoever completes those post-tests will be entered into a raffle to win $30. So without further delay, let's bring in our speaker who will now discuss emotional health.
Thank you, Dia and Kavya. It's been a great opportunity to learn and to prepare and come and share all this with all of you. So thank you for signing in. It's been an exciting time. With that, I'll just start my slides. Great. So we're going to be talking about the mental and emotional parts in the menopause. And I know a few of you may have attended the other sessions, but still this is probably a good ground zero to start. So menopause is defined as the menstrual cessation or stopping of your menstrual cycles after 12 months. So the period of 12 months, if you don't have any cycles at all because of an ovarian failure, then it is menopause. And there is no blood test. It's very arbitrary. You have to track, you have to be of a certain age, 40 or older. And it is not because of contraception or other, like a surgical cause where you've lost your uterus, which also is called surgical menopause. But the natural course of medical menopause is basically when 40 and above, you stop having your periods for at least 12 months. And we were talking earlier today about how this can be very vague and how you track, and suddenly in 12 months or a year, you've stopped having it. And I want you to probably just think about what that end of 12 months would be. And let's come back to that point later. Perimenopause, on the other hand, etymologically, peri means around. So perimenopause means the transitional phase. That is what you're going through by the time you attain menopause is called the transitional phase, where you have irregular menstrual cycles. And again, there is no blood test, there's no way you're diagnosed with other than clinical, where you're experiencing these symptoms. You're having vasomotor symptoms like hot flashes in the night sweats, so you're having panic or palpitation. You're having heavy blood flow or light periods. So there is a lot of changes within you in the body, in the period cycles. And so that is called the perimenopause. And a lot of us above 40 and above are experiencing this. And we're waiting for this to be done, or at least talk about this, I hope. Emotional piece is, in addition to these physical symptoms, when your mood, when your sleep, when your psyche, your soul, your social connections, the way you work, the way you feel, the way you have energy, all of those are changing in tandem with your body. That is the emotional health changes that you're going to talk in relation to both menopause and perimenopause. Now, mental health in menopause, almost 1 in 3 are experiencing it. So it's a very common thing. It's not that everybody has only the physical symptoms of your periods changing. So you are not alone if your mood is affected, if your sleep is affected. And studies have shown that the perimenopause, not the actual menopause, which happens after 12 months, but the transitional time is the most vulnerable time when women are experiencing depression, anxiety, or insomnia, or in other words, sleep changes. So those are the common symptoms. What is not linked is like much severe psychiatric symptoms like bipolar, having psychotic symptoms like hallucination, suicidality. They are not related. The common things are depression, anxiety, and sleep changes. So if you're starting to feel some of these symptoms, then please talk to your primary care, or maybe get a referral to a therapist through your primary care. Sometimes, if you're able to talk to your primary care and confirm this is what you're going through, then get a referral to a gynecologist. I think it's really important to be an advocate for your health. I know getting these referrals can be a task in itself, but if you're not doing it, nobody else is going to do it for you. So being an advocate for yourself, you can do it. What are the risks of developing these mental health conditions. If you had a previous history of depression or anxiety in your lifetime, then you're prone to developing more mental health symptoms during your perimenopause. If you've been through a lot of stressful life events as a child, a woman, a girl, and a woman, then yes. If you have a higher BMI, body mass index, or a weight, then definitely all of these three things put you in a higher risk for experiencing emotional symptoms during perimenopause. The last two sessions before today were about lifestyle changes, exercise, and nutrition. Those are good places to start. Regular exercise, good sleep habits, stress reduction. I know we're going to talk much more about stress reduction today, but those are probably the first place we can all start. But before we even start, the first step is acknowledging. I think the awareness that you're going through a change is the first step. And the second step is you're often going to be questioning if this is right or wrong, what you're experiencing is real. So, talking about that either with a professional or with your friends or with your own family is important. So, the awareness is what is the first step. Acknowledging is the validation that you know that you're changing. Once you acknowledge that, that is when change starts happening in terms of seeking help. So, the common treatment approaches are lifestyle changes. The next is therapy, cognitive behavioral therapy. I'm sorry for putting the abbreviation here. Cognitive behavioral therapy, which is one of the modalities of psychotherapy for mood, anxiety, and sleep, can be very helpful. After that, if your symptoms are persisting and you're not getting relief from these two approaches, then you think about medications. Sometimes hormone treatment and therapy go hand in hand, both of them complement each other. And I think Dr. Tapti in our first session talked about hormonal treatment. And the last step is seeing if you're a candidate for antidepressant or anti anxiety medications. So these are all some common treatments that I want you to think. And lifestyle changes is definitely the after validation, lifestyle change is the first step. Therapy, wait for try consulting with your PCP and your gynecologist, talking about where you are and what are you optimal for. So these are common and treatable. That's what I want you to take home is knowing that these are very prevalent. So talk about it and know that it is treatable. So first thing, let us take the sleep issue, right? And why suddenly your sleep is going off and it is correlated with your cycles. And talk to your doctor about hormone treatment. There are also non-hormone treatment if you're not a candidate. So treatment a little bit early on in your perimenopause, you are a candidate for hormone treatment. Later on, or if you've had cancer history in your family or other medical causes that are not making you an ideal candidate for hormone treatment, talk to your doctor. Go with questions. I'm going to say this, I'm going to regret it later, but maybe do some chat GPT work, Google work. It is okay. The doctors are not going to be very comfortable answering all your questions, but please have some time to think about this and go prepared to talk about what and all are your options. So start about hormonal treatment. If that's not an option, what are the other non-hormonal treatment? Sleep problems. Some of the major issues for sleep is both medical and psychological. So once you rule out medical issues, then think about psychological, what are causes of it? Anxiety, depression, or is there a lot of stress going on? Everybody doesn't get diagnosed with depression, anxiety. Sometimes it can just be a lot of stress, which when persisting can become depression and anxiety. So we may be able to catch it early. There are also lifestyle changes that we can think about for sleep, which is limiting our caffeine, keeping regular sleep times, optimizing the room temperature, what is our mind, meditation or physical activity before sleep, because exercise definitely we know helps reduce the stress. So, what are the lifestyle changes we can do to first address sleep? If the sleep problems are persisting, then think about medical and psychological causes. And the psychological causes today, which we focus in my talk today, we can address that with therapy. And one of the key therapy It has been helpful for sleep is again CBT. And I'll tell you what the CBT is about. I keep saying CBT. Bear with me a couple of moments and we'll talk. The other aspect is also getting accommodations. So you're not living in an island, right? We're all living in our communities, from our family to our workplace to our friend groups. So when we draw support from all these other communities that we are a part of, that also reduces our overall stress. So the CBT that I keep talking about, you may have heard it, and so bear with me as I walk through it. It is a way you train your mind. And I put this picture because it is everybody knows how to play this game. From our childhood, we have learned it. So now when you see those, you immediately there's a part of you that wants to jump the numbers and do ascending order numbers and descending order numbers. Like that, you train your brain to understand the feeling, to understand the thought that comes with that feeling, and to understand the behavior. So we'll go forward in an example, but before that, I want you to remember the feeling, the thought, and the behavior. Those are the three things we are trying to understand. And when we change one, the other two changes. So that's what we are doing in cognitive behavioral therapy. Like the name goes, cognition is becoming aware of the thoughts and feelings, and behavior is the action. So the thinking and the action has to have an impact. And that has shown to impact how you feel about menopause and how you struggle with even the physical symptoms like hot flashes. One second. Even your physical symptoms like hot flashes, night sweats, the irritability, sleep, all of that occur in menopause can be impacted by cognitive behavioral therapy. I don't want to oversell it. At the same time, that has been the one of the modalities that has shown the maximum impact. So maybe that is a good tool to have in your toolbox, in addition to the hormone treatment, in addition to other modalities of care. So, for example, let's run this. One way of CBT is take a situation around the menopause when you're feeling overwhelmed. Try to describe what the situation is. For example, they've given us here your heart is racing, or you suddenly feel very hot, whether in the night or at workplace, or you have a tightness of chest. Usually, when this is happening, as you walk the slide with me, think about what is the next thought that comes into your mind. You can have many thoughts. Oh my God, what am I going to do? Am I feeling incompetent? Am I feeling weak? How am I going to do the presentation? Nobody's going to understand me. There can be myriad of thoughts that come your way. Pick one thought that makes you feel really, really stressed. And then think about the cultural things that we bring along. There are things as a woman, as a competent woman, as a mother, as a wife, in the society, how you've been raised, has put on certain judgments and biases that you must stay composed, that you must prove yourself. Periods pain is not something you can reveal. That is going to definitely make you feel like a weaker person compared to the other women or the people in the office or at home. How can you, the mother who has to model this for your child, be broken down by something as small as a racing of heart? That must be fine, right? So there are things that we have been taught about that immediately comes and masks our vulnerability. And then with that, we go into feeling anxious, feeling ashamed, sadness, or irritation. Pick one emotion that often goes with these experiences, or maybe all of them come together. I would feel if this is an experience that happens to me at work in the middle of the workday, I'm having a presentation and I'm feeling a lot more hot flashes and a lot more nervous than usual, then I got to know that that is probably a week I'm going through something. I would feel ashamed because I can never get past that to go and do a competent work. So then what can we do? The CBT part comes right here. So one of the things is gently questioning, is this 100% true? Am I a weak person because I'm experiencing this symptom? Or I'm having a tough moment. The balanced thought would be a more realistic interpretation. I'm having this tough physical experience, but I'm still capable of doing my best. Maybe knowing that you can hold both truths together. Yes, it's very uncomfortable. I'm sweating. At the same time, I can still get through this day. And it's holding those opposites within you that's really important. And actually stepping back, you have held that many times in your life. You're getting late, and yet you can get dressed and you can go competently. You're having a meltdown, and yet you're pulling yourself together and doing that cooking and getting past that day's toughness. There are many times when we do the opposites and we hold it within us and still function. So, this is one such moment. This is not Greek and Latin. You have done this through your hip reflexively many times. So, get to that thought of asking, is this 100% true? Because in your emotion thinking, you're going to think the worst case scenario. And we are never kind with ourselves. So, thinking about that and coming to a more balanced thought, the next thing is having a sense of agency. When you have that, when things are out of control, what is one thing that you can do to control that moment or be in that moment? You can be in that moment, you can breathe, you can be kinder towards yourself, you can look at yourself with the help of your friend, maybe imagining what your friend would do to calm yourself that day, or you can reach out to a friend, or you can go to the bathroom and have a splash of cold water, drink water. There are a lot of things we can do in one small way to accept that moment or have a sense of agency and change that moment. And that's what this whole therapeutic approach is about. Knowing that your thoughts are shaped by your body and feelings, culture, and life transition. They are not facts, they are not written in rock. You can soften them with your awareness and compassion towards yourself. On this note, I'd like to take a pause. One of the things is that when we reach our first puberty, or when we get pregnant as women, or when we are working towards pregnancy, there is a certain attribution the society and we have given meaning to it, right? We are blossoming into this womanhood, we are bringing this life into this world. But when we are coming to menopause, are we really able to still glorify that change within us? I don't know. I want you to think about it and bring that later for our discussion. When menopause comes, are you looking at yourself as a withered flower? Are you looking at yourself as no more having purpose in life as a woman? Because there is a certain amount. Are you looking at it as the glorious days of my beauty are gone? It's how we attribute meaning to that menopause. Then we sit with it and then we are able to be kinder to it. And you have the power to make that your metaphor. You don't have to rely on what the society is giving. More and more media is coming into empowering women on this, but we don't have to wait, right? We can make that change and be the change ourselves. All right, let's pause on that and maybe step back and take a deep breath and look into menopause and immigrant culture. When you travel, I know a lot of you are participating here from both India and the US, but in general, when you're migrated out of your comfort zone, then you tend to be more prone for physical symptoms and mental health symptoms because you're acculturating, changing from one to the other. There is always a question of immigration enforcement, whether you feel safe enough to be in this new or old country. You're always a second rated citizen here. Prior trauma, whatever you've carried from the past, social isolation. To name a few, these causes you to be more risk for menopause symptoms. There are other things too that add on to that pile. Limited health insurance, cultural factors that make it harder to talk about menopause. Sometimes we may not have the vocabulary to even validate what we are going through. A lot of times, primary care are going to tell you, oh, that's menopause. It's okay, you can wait it through. Some of the primary care physicians are now more informed and are able to give you a referral or talk about hormone replacement. So if you are facing a primary care who is being a glass ceiling and not letting you proceed, it's time to think and change because these are all some of the factors why you are not able to get the help you can. And the last thing is stigma. Is this even worth talking about? The stigma that both we have and what society puts on us. Another aspect is a lot of times, if mental health symptoms are not vocalized and acknowledged in our society or seen as weakness, then we tend to experience mental health symptoms like depression or anxiety as body symptoms. A lot of people have white discharge, vague body complaint, low energy, because that has more value. Physical symptoms carry more value. Our husbands are noticing it, our family is noticing it. But when you say mental health issues like I'm feeling anxious, they're not able to see that. When they don't see it, then they don't acknowledge it. And that holds good for us also. In immigrant cultures, individuals with depression commonly present body symptoms rather than the mind or the emotional complaints. So be aware of that. Why are we more prone? Because of the stigma, because of migration related stressors, cumulative trauma, longer residence paradox. You're probably accultured in a city, in the dominant community more, and therefore you are more isolated from your own kith and kin, and now you've differentiated and you don't belong. So where do you belong? That is also a question. You've changed so much that you don't belong in many circles that you used to be. A lot of that causes mental tangles, and those tangles, if not acknowledged, come as body symptoms, and they can be complex also in our menopause. The last slide I want to talk to you is, again, we are all not living as individuals, right? We come from a collectivistic society, particularly here in the United States. We live in a very individual centric society. It's all about only you and how you thrive. Maybe it's about your family, but nothing beyond. So you are prone to carrying more because you're also now working women. You have another community. You are probably in a sandwich generation, giving care for both your children and family as well as your older parents and in laws. You're also now at the time where around menopause is when you become an empty nester. And that transition of who you are, you've gone from being this mother 24/7 caring, you don't have anybody to care about other than you. And caring about yourself is not something you're used to because it is termed selfish. Or maybe you will be called a narcissist. God knows who we are. And then you're dealing with bicultural adolescent children, children who are also transitioning. For people in India, it's a different generation. Their thinking and the way they see life and dating and culture, everything is different. So you are now parenting a different generation that speaks in a different language. Long-term marital conflicts that are coming because of now menopause and perimenopause is also making it uncomfortable in terms of sexual and marital relationship. There is a lot more distance between you and your partner if you're not able to communicate that sexual difficulty or you're being silenced. History of being in a patriarchal society where the man is more than the woman. And now with menopause, you feel even lesser than yourself. Sexual problems that distance you, make you feel more disconnected in your own marriage, and unresolved family conflicts. I'm just picking up a handful of how during menopause, when all these things overlap, there is a high risk for you developing more and more emotional issues. So if you are experiencing a few, then maybe it's time to really pause and think about how to get the help you want. So what helps? I know we talked a little bit about CBT, cognitive therapy, talking to your doctor, but studies have actually shown that women-centered, that women who come together and form a peer group where some level of respect for each other and very focused on this particular topic can be highly supportive. It can be validating and supportive. Even with a friend, one or two, if you talk and make a WhatsApp group and say what you're doing and share with each other, it carries the power of N, it carries the power of validation. Particularly in an immigrant community or in your own, again, when I say culture, I don't mean just India versus the US. There can be micro cultures, right? In your workplace setting, within your own community, there can be micro cultures. So finding your culture, finding your cohort is really important, or finding a faith-based or complementary based. If there is a group that is very much about finding out the different supplements that they take, that helps, great. So what helps during menopause, particularly for the psychological acceptance and relevance, is women-centered, groups, knowing that it's culturally sensitive, it can be faith based or complementary approaches. All of that have been really workable for immigrant families and women. I think number one we need to accept is change is unsettling for all of us, but you can choose how to respond. And this is where I want to bring the fact that I told you before. How do you see yourself going through menopause? Do you seeing it as stepping down the pedestal? Do you see that something very powerful about you is changing? How can you be powerful despite the change is going to be key. The change is going to happen no matter what. What makes you a powerful person who took on pregnancy 9 months and went through that and found that meaningful looking back? But right now, going through this 12 months or maybe 3, 4 years of perimenopause, very unsettling. You have all along been through change, whether it is going through your body changes or marriage related changes or childbirth and raising children. You've been through change. Change is inevitable. But how can you choose to respond to it is the key. And so, one place that we can impact change is our workplace, right? For those who are working, if you are at the level of leadership to create policy, you can think about promoting awareness. In the US, there is no official federal policy for getting leave when you're going through your severe menopause symptoms or anything related to your menopause. However, that doesn't stop us from creating awareness. When we have Valentine's Day, when we have Halloween, we can make a menopause day. We can promote awareness. We can create some kind of a logo and have everybody participate, bring humor, make it a lunchbox seminar so that everybody knows. They're going to tease you, but that's okay. That at least breaks the stigma, right? You can promote a policy. You can have a comfortable environment. Those days that people go through, they can have something to at least make sure we can change the air conditioner or have a room that is less about the temperature control and have access to things that make them comfortable. If you are in the management place, and maybe you think about, okay, how can we bring a policy on occupational health regarding this? One thing is your primary care can always write about a letter saying they don't have to call it menopause. They can always say low energy and some symptoms and then ask you for some protected pay leave. It's called family medical leave. You can get that. So, first understand in your workplace, unless you talk about this, I don't think you'll be able to get help. And the last thing is what has been shown to work is again having therapeutic groups, right? Like these support groups at the workplace. There's something about going to work and being empowered there, or something about going in your community out of your home and being part of a group that has shown to be really helpful. So, definitely organize small group, but you may need some professional help in getting that group to be a confidential space to then work through and for a limited time to see how that can be helpful. Marriage is another important place, right? We need to make sure that our partners are able to understand what we are going through. And it's very big topic. Sex is a taboo topic, but I'm sure bringing about that in small ways can be very powerful as a woman for you. So if you are not able to go through the sexual practice because of a dry vagina or because of pain during sex, it's important to talk about that with your partner, about why you're going through this. If you're not able to talk it, maybe take them to the primary care appointment and have the doctor provide information to both of you. Maybe go for couples therapy for a few sessions to understand how you could do it otherwise. But if you're able to talk, then good for you. Talk about how intimacy can be different, not just with sex, but in this life where we are constantly running about, there are other ways. Maybe just sitting down and watching a movie together, maybe the foreplay, or maybe even making yourself presentable in some way and asking your partner to make it presentable and just have an evening where you go out for a drive and come back. So, sex can mean many things, and I'm going to leave that to expert of the marriage and couples therapist. But I'm going to say, like, acknowledging it, having a language with your partner about it, being able to be gentle about it. First of all, you appreciating yourself, and then connect with your partner to find other ways to be intimate. And if you're having more of the physical discomfort, or if you're going through depression and you have no libido, or if your partner is going through a real difficult time, then maybe getting professional help. That's why the colors are different. What you can do and at what point you can ask for professional help. It is a mindset change. So we talked about the work, we talked about marriage, but what about the internal schema, right? We all have our own minds that we can definitely choose what resonates within us in terms of change, and then we can empower ourselves and heal. I know these seems like words. I'm going to show it to you in a couple of minutes what these words mean. Walk with me. Different spiritual books and philosophers and philosophies talk about this. We have all seen that a seed, or we all know through our own years of experience, that a seed must go into the soil, break open. It literally breaks open, and that's when the shoot comes out and the root comes out. So, change is very powerful. A seed must break open to grow. And sometimes growth begins with that discomfort or change of breaking open. So, can you envision, is this something that resonates with you? That can I be the seed that breaks open? And you've gone through this as a woman multiple times in your life. Only when you are broken open, then things happen to you and around you. But at the same time, when menopause is happening, can we recognize this? Can we take a few moments to sit with that picture, that image? And I know many of you today are doing gardening. So this is already something that you're doing when you see new life coming. Can you envision yourself as a seed that is growing and wait and hope till those shoots appear? So, likewise, the next thing is a metaphor of light. The light is most visible in a dark place. When you're going through this darkest period of change, can you be a light for yourself? Can you be compassionate towards yourself? All along, you've ran in your life taking care of everybody else from morning to evening. Can you wake up in the morning and show compassion by just sitting with yourself and having that coffee and knowing that you're capable of inner strength, faith, and compassion? Only when your pot is full, you can give it to the others. If your pot is not full, you will not be able to cater to the needs of others. So, then what are the ways you can fill your pot? Gratitude is a good place to start it. Connection is a good place to start it. Finding meaningful connection. If you want to help or volunteer or be there for somebody else who's struggling worse than you, all of that makes your pot full. So, can you be a lamp for yourself before you be for the world? Again, sit with these metaphors. I'm just giving this as example. Choose what resonates to you. The next step is talking about how a river changes metamorphosis before it reaches the ocean. Yes, it changes in many, many directions, but the essence the water carries is the same. Your roles and surroundings may change, but your essence remains the same. Can you embody that? Already, I'm going to now come out of this presentation mode for a minute because I want to pull all of you into discussion, if you will, and make sure that this is relevant for you. I'm going to again bring the slide, but you can participate. One of you can volunteer with me to walk through a CBT slide with me. And I'm going to ask Dia if it's okay to open that up for discussion. So can you see this?
Yeah, we can see the slides. If anyone would want to participate in a scenario.
Yeah, I just want one here to come up with me and walk through this. We've already went through this slide. It's a CBT exercise, and I'll help you to. It is not scary. Come on, you guys. I bet you're going through this a lot. But is this relatable?
Yeah. I can work with you, Sissy.
Great. Thank you. Thank you, Abhi. Okay, so coming back to the slide, right? So I'm assuming that you've gone through perimenopause or menopause in some way. Can you draw a moment where you've had a body signal of something about your body that was really making you uncomfortable, a situation? And can you
Uh,
share here with us?
Palpitations, like it, all of a sudden you'll start feeling that I would start feeling that I'm having palpitations
Mm-hmm.
and my chest will tighten.
Mm-hmm.
And sometimes I would be cooking, and then all of a sudden I just feel as if I have no energy left in my body
Mm-hmm.
and I just need to sit down, or a lot of anxiety. I felt a lot of anxiety, and there was no, sometimes there'll be no reason why I am anxious, but in the middle of my work day I would feel as if something bad is going to happen and I'll be very anxious. So those were
Yeah.
some of the things that I felt.
Yeah. So cooking or workplace feeling so drained and anything to do with the heart immediately catches our attention, right? Because the heart is such a precious thing. It's life and death, and that in itself can be such a big burden. What are some of the thoughts that have come to you? Because our brain is
Mm,
to be on a survival mode in such a place, so
mm.
automatically generate negative thoughts. So what are some of the thoughts that come to you if you could picture yourself in that moment?
In my office, I used to feel very like um, vulnerable because you are in a public setting and the IT offices are not personalized anymore. So you are sitting in with everybody seeing you and you are
Hmm.
kind of breathing hard, and all of a sudden the person sitting next to you will be like, are you okay? Do you
Yeah.
need something? So the attention that you don't want to draw to yourself gets drawn involuntarily and you don't know how to explain it to people.
True. And there you are put in the pressure of saying okay when you're not okay, right?
Yeah,
What
you
does not okay come to you? What does not okay bring up to your mind?
it's just that, like, if I, so I would say that, oh, I'm not feeling good, I'm just tired, right? But
No, no,
in
internally, before you tell them out,
mm,
internally, what does I'm not okay mean to you? What would that make you feel about?
a lot of times, like, used to feel that, am I not it kind, like, I personally was feeling that, oh, I'm not able to do things the way I used to do.
Right.
Am I losing my sense, like myself?
Mm-hmm.
um I am somebody who has so many people kind of relying on, and then am I failing?
Right.
uh,
Let's
it's
pick your
very negative. The
yeah,
process is very negative because you don't know that
yeah,
why you are going through it. You
right.
kind of want to put, um, it's like putting a face to a name, right?
Yeah.
You are going through something but you don't know why you are going through it, and you are like, I didn't do anything wrong, or I have been so, why is it happening? And in my case, like, I am not very good at going to doctors regularly, and I was under the impression that I have already passed all of these things, so it was a shock for me.
So it's a shock to you. It makes you feel weak, and also you are many people are relying on you, and so it feels like you're failing the system. You're failing the people who are relying on you. So you see how
Yes.
negative thoughts then goes to the cultural, the identity of who you are. You're a person who's supporting everybody in your family and beyond, and so all of those systems are collapsing right there, right? And if I
Mm-hmm.
would ask you, looking at the slide, which emotion was heightened? Anxiety, shame, sadness, irritation?
All of them were there.
All of them.
They, yeah, all of them. In that moment, you just feel that you have failed yourself. And that feeling brings so much shame, so much pain. And some, like, and again, the thing is, you're living a dual life, right? You can't be yourself in front of others. So you try to be your happy go lucky self.
Mm,
And in your personal space, you have broken to pieces,
yeah,
so then you are doubly carrying the trauma now.
yeah, yeah. You bring a really good point. I'm going to the next slide, but hold your thought there. You bring a really good point because a lot of times we don't have the luxury of doing the CBT right at the workplace. I can tell you, but like what you said, you have to fake or you have to put the facade that you're well enough. And by the time you take your own personal space, it can be even the end of the day or or somewhere else. By that time, multiple experiences could have colluded and you can become even more miserable. So, for the sake of this exercise, right? Thank you for sharing how intense this experience can be. But if you were to come and take a moment for yourself, like maybe walk out of your cabin and think about what could you have done? What did you do? Did you avoid the situation, stay silent, hide the symptoms? And I think you said you hid the symptoms and you tried to function. If I were to ask you, are you really failing yourself? Like, is this 100% true thought? Are you really failing? Are you really not okay to the point where all your systems are collapsing?
Today, I can say that they were not failing, but in that moment, it was very hard to understand that it is not the system which is failing, it is just one part of my brain that is causing it.
Right, right. Yeah, well said. It has taken a long time, right, today to say that. But I think the key here is thank you for telling how long the time has taken for you to realize that. The key is if we start working on this gentle tool on a day to day life experiences, then we could start stepping outside of ourselves and seeing it. We are not our symptoms. Heart is racing, Abhi is collapsing. No, Abhi's heart is racing. Abhi can still step outside and still function. And she is functioning and she is telling okay to her friend. So the ability to come out of your symptom and look at yourself and do this process will take time. As simple as it is, I want you all to take home this one message that this is one tool that you're doing in other aspects of your life, but develop consciousness and start doing your day to day experiences like this if you can. So, the next thought is a more balanced thought. This is uncomfortable and not dangerous. Can you tell yourself that? Can you tell you can handle the moment? Can you tell
Hmm.
anything that will help you even stand in that place and go through that experience without collapsing?
Yes.
Initially, till you recognize it and you accept it, it is hard. But then comes a time where you start telling yourself that I can't be this person. And then you start taking those exercises that, like when I used to feel too anxious, I'll just go outside
Yeah,
and walk in the sun for a few minutes and
yeah.
then try to think about something which is not making me anxious, instead it is making me happy. Another thing I used to do was I used to call my husband. I'll just call
Mm,
him and I'll tell him that, see, I'm feeling very anxious at this moment. Can you just talk to me for 2 minutes or just listen to me? If
mm,
he's not available, I'll call my sister or I'll call my friend. So
mm,
I had a touchwood very strong. I still go through it. So I still have a very, very strong support system
mhm.
without whom I think I wouldn't have been able to come out of it or at least survive what I have been going through.
Yeah, thank you. You just literally walked through my slide fully. Your agency is critical. I just want to recognize that the moment she stepped out of the room, right? That is where agency. She took agency and she was able to do something about it. Not change everything, but that agency. And sometimes we say pedicure, sometimes we say go shopping, sometimes we say retail therapy. Whatever she did or we can do is our agency. Once we know we can take care of it, then automatically these things don't distress ourselves anymore. And the last thing Abhi talked about is about her friend or who helped her and filling your cup there. So I want to call into attention. We did this exercise today. Thank you, Abhi. Thank you so much for participating in. And I want to go to the last part that you are not alone in this. There are a lot of things you can do. You either seek a partner or your best friend or a girlfriend, but start putting together a group because you really deserve a village. And we come from India, collectivistic society, where it's always about being surrounded by people and we are never alone. It is our society and who we are as a family, right? So pull together that family or that village for yourself. And I put these two things here because it's really, if you walk away today, just know women speak men, but men don't speak women. That's Meryl Streep. I love that quotation because you have to be your advocate, whether it's your primary care or whether it's with your husband or with your manager. You have to let them know. And yes, you have to step past that embarrassment to educate them what you're going through. And the second slide I put is favorite movie of mine. Ask um, is Dear Zindagi here. It is unfair and unrealistic to expect one person to fulfill all your emotional needs. You need a village. It can't be your partner, it can't be your child, it can't be that one friend who can take it. Surround yourself with your friends and with your treatment team, whatever works for you. You need to know it's manageable. So I'll stop with this. I know I went overboard, but then we asked for the discussion. I'm happy to take questions at this time.
Yes, we do have a couple questions from our pre-test. And then if anyone has any questions, please put them in the chat. But so far we have one is about how to avoid conflicts. Sometimes they can be highly emotional, but how do we balance social life without much frustration? I know you kind of touched upon this, but if you could maybe answer that specifically about avoiding conflict when you feel very emotional and frustrated.
I think it's a big topic, right? But an important thing is when first thing, like I said, recognizing your emotional. And even to recognize that we need to do these exercises every day in meditation or a mindfulness or sitting together with your own self and understanding what kind of upheavals you're going through in a day. So the first thing is awareness. If you feel you're emotional, then once you recognize it, are you able to take a few minutes to first de-escalate yourself? Can you come out of a 10 out of 10 to a 5 or 4? Because then your frontal brain, right? You're not operating from your emotional brain that is going to blurt out and then you're going to have really bad consequences everywhere. So you're trying to get your brain to a place where your frontal brain that is thinking and your emotional brain that is going to be very vulnerable both come together. So calm yourself, awareness, calm yourself, and then think about how you want to act out or talk about how you respond. Anger is not an issue. It is not bad to show your anger, but it's how you communicate your anger, how you communicate your conflict that is the key. So, first of all, one of the things is conflict doesn't mean you're the person who's creating the problem. Conflict means there's something that is going on that is violating yourself or causing you to create that communication. So, when you calm yourself down and then you put that communication out, that conflict can be going in different ways, including you agree to disagree. So, there are some biases that are going to come about conflict internally that is also going to make you nervous. This is a big topic on its own, but I think it starts from self awareness and how you choose to respond.
Anyone have any other questions? Yeah, I actually had one. I guess this perspective is from as a daughter of someone who is going through menopause, or I have like a lot of aunties and people that I know. How can I best support them, and how can mothers who have children who are a little bit older and are able to support, how can their relationships kind of change during this time?
I think that's a nice question. Thank you for asking it because I think as a woman, particularly as a daughter, we think we know our mothers like the back of our hands, but we may not. And they are changing, and you're changing. It's a dynamic thing that's happening. The important thing is to knowing that this is not just a mother you know all the time, giving her the space to be who she is at this time, being curious about what changes she's going through, and being able to provide that listening space for her. A lot of times when we are going through these things, we cannot put a stereotype on the person, right? Just like anybody, when you will go and ask your question to your friends, you'll ask them what's going on. Just like that, the curiosity is the one thing that it can create a window of opportunity for your mother to just speak. And then you being able to, without your bias, being able to have a listening space for her and not judging her and giving her the space to be who she is. It can actually make you very uncomfortable to know your mother who always has answers, who always fixes things, and is going to be the embodiment of caretaker is actually breaking down. It can actually even bring grief and making you feel vulnerable. But it's okay for you both to resonate that you both are vulnerable, that you both are changing, and maybe there is a changing role right there as you speak to her. And so being able to be that person to talk to your mother is really important without a bias.
Thank you so much. And then I think we have one last question. I have observed that there are some triggers like some trigger words that rage bait me. Is there anything we could do in dealing with that?
Can you give more examples of rage baiting? I know that's a very generational chat here.
I just, I guess words that trigger basically, and it makes you feel like you have to have a reaction.
Yeah, when people
say calm down or to chill.
yeah, because they are making a judgment on you, right? That means you're a raging person, right? I think that's really important. Like you can ask them curiously, like, what do you mean? What do you mean? What are you telling me? And you can ask them to explain. And in that dialogue that you pick up, you can actually help them understand how biased or how stereotypically they are trying to fit you in a box. And only when you are in that box, then they know how to respond to you. And maybe having a dialogue and being curious about why would you say that in a very calm manner. Again, this was the first question. You have to first understand that you're getting rage bait there and you're clinging on and you're starting to pile up. Being able to calm down and say, listen, I'm right now very angry, but can I come back and talk about this? And when you talk to them, ask them what was happening in that moment for them to put you in that box. Help them flush it out. And when you flush it out, you will see that they're trying to put some judgment or bias on you that you're not worthy of. And maybe you have an opportunity to explain what you're really going through. And maybe you can apologize for being reactive. Maybe they can apologize. Again, this is a fairy tale story, right? But at least the end of the day, you both can at least talk about it. But for that, you need to be in a place to talk about it without your emotions interfering. I agree, Raji. I think we need a very positive, and a lot of media are actually picking it up about ageism and talking about how being beautiful in that age and not coloring their hair and not trying to fit into the traditional women stereotypes in this age is really important. Yeah, yeah. Thank you, Kirti. I think talking to them about it take them for coffee and ask them what was in that moment that made them tell that. And if you give them an accepting space, maybe they will give you an accepting space to talk about it.
Well, if we don't have any more amazing questions, thank you so much, Dr. Margaret, for such a holistic and completely wonderful, informative session. We want to remind you again to please fill out our post-test form that Kavya has put in the chat. This helps us with any future sessions. To get your feedback is really important for us, and you will be entered in a $30 gift card raffle for filling it out. But thank you so much again, Dr. Margaret, for your time. This session will be recorded and posted, so you can share it with all of your friends after. And yeah, thank you so much.
Thank you, everybody. Great opportunity. I hope you benefited from it. And as Raji says, yes, agency. You can and you are be the agent for yourself.
Good night, everyone. Thank you so much.
Thank you.